We're grateful to have a practicing medical professional on staff. Dr. Mallika Marshall answers some of your questions about coronavirus.
Trish from Canada writes, I want to know why all these surgeries have been canceled. Mine was canceled and I'm in a lot of pain. And Trish, I'm so sorry. And it's not just happening in Canada. It's happened here in the United States as well, where elective and non-emergent surgeries have been postponed to protect patients and healthcare workers and free up hospital beds for coronavirus patients. Obviously, hospitals are anxious to get back to doing their elective procedures, but that's going to be based on the availability of testing and PPE and a plan to sort of reschedule and prioritize those backlogged procedures. Our next question comes from Bill in Northbridge, who asks, if there are 1,000 new COVID-19 cases reported on a given day, how far back did the new cases actually come into contact with the virus? So the average time between when someone's exposed to the virus and when they develop symptoms is about 5 days, but it can range from 2 to 14 days. And remember, everybody who's infected doesn't necessarily get tested, so the cases that are reported every day is probably a dramatic underrepresentation of how many people are actually infected at a given time. Mike writes, is there any evidence that having an up-to-date flu shot and the pneumonia shot might help mitigate in any way the effects of COVID-19? So Mike, neither the flu vaccine nor the pneumonia vaccine are going to protect you from the coronavirus, but both are still really important. We all should be getting our flu shots every year to protect us from getting the flu. And in general, people over the age of 65 should get a pneumonia vaccine to protect them against bacterial pneumonia. Our next question comes from Jack, who writes, I see people hanging their coats outside in the sun, especially after they've gone into the supermarket. Is this necessary and does it do any good? Not necessary. Probably won't hurt, but experts say that clothing, including things like coats, probably don't pose much of a threat unless you've been directly sneezed or coughed on, or if you've rubbed up against something that might be contaminated. If you think that's the case, then you really should wash your clothes, including your coat. Otherwise, the most important thing to do when you get back from the supermarket is to wash your hands well with soap and water.